On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. And today we are joined by one of our wonderful new OB-GYNs, Dr. Mia Mowzoon. Now, Dr. Mowzoon trained in a high-volume obstetric setting, giving her the experience to confidently manage the unpredictability of pregnancy. Dr. Mowzoon is focused on creating the best possible birthing experience for new mothers. She believes in patient-centered approach with an emphasis on a positive birth experience. She has been practicing for 4 years, but just joined us here at Covenant Health. So welcome to Health Her Way and welcome to Lubbock, Texas.
Thank you.
Yes, we're excited to have you today.
Yes, we have a lot of questions for you. One of us on this couch has had a baby and one of us has not. And so one of us feels like maybe she knows something, but would definitely love a professional opinion on the matter. So we want to jump back in.
And one of us has lots to learn.
Yes, and that's okay. That's what we're here for, is to really break it down. And obviously, one of the things we talk about on Health Her Way a lot is the internet and how it can be a really wonderful place and a really horrible place at the same time. And so we want to kind of debunk some of the myths that we hear. And I think a good place for us to start is with fertility. So for those who maybe are not ready to start their family, but want to in the next couple of years, when do they really need to think about fertility and if that's something that is working well in their body or not?
Totally. So I usually tell patients, if you are in your 20s, it's not something you need to focus on unless you're ready to start your family, right? If you are in your 30s, you should be thinking about it regardless. Are children something you want in your future or are they not? And if they're not, then, obviously no reason to focus on it. But if they are, and maybe you're not ready for children quite yet, you should at least be thinking about how can I optimize my fertility and my gynecologic health? Because the worst thing that I hate to see is when I have a patient who comes in who's 38 or 39 and is like, I think I want to have a kid in a year. And of course it's possible. I have many patients I've delivered over 40, but it is harder. And as we all know, we have a biological time clock and it shouldn't rule your everyday actions, but it should be something that everyone's kind of thinking about after 30. So at least getting themselves in optimal health, making sure they're established and kind of starting to think about that guideline.
So what are some of those?
Sorry, that timeline.
Oh, no, you're good. So what are some of those factors that we might not think about that do impact our fertility and should start thinking about when we're maybe considering children?
Totally. So I think the most important factor is your overall health, right? So are you a good, healthy, normal weight, right? Being overweight can lead to a lot of risks in pregnancy. So being healthy, are you pre-diabetic or have a high risk of getting diabetes? Do you have high blood pressure? Do you take other medications, right? Because optimize your health before pregnancy is the best way to have a healthy pregnancy. And if we're talking about fertility and like getting pregnant, I would say the most simplest thing to notice is like, are you having regular periods? If you're not on some sort of contraception and you're not having regular periods, that's something you should investigate like first and foremost, right? Being a healthy weight, getting regular periods, looking at your medications, and also looking at lifestyle. Lifestyle impacts fertility significantly. Smoking is a big thing that impacts fertility, whether it's cigarette smoking, marijuana smoking. I recommend no smoking, of course, but these do really impact fertility. People don't always realize.
How does age play into your fertility factor? And what are some things that people get wrong when it comes to your age? And I think a lot of people think, oh my gosh, after 35, you're geriatric, but maybe that doesn't mean what we think it means. Right. So help us understand how age plays into it.
Totally. So definitely we're born with a certain amount of eggs, right? And we don't increase the amount of eggs that we make. We're born with that finite amount. And after 35, there is a sharper decline in our ovarian reserve. That doesn't mean that you can't get pregnant and have very healthy pregnancy and healthy babies after 35. But what we do know is after 35, we do have a slight increased risk of lots of comorbidities during pregnancy, which is where that geriatric term came from, which I hate more than anything. You do have a slight increased risk of preeclampsia, of getting gestational diabetes, of having a C-section, lots of other things increase. But as we all know, and I'm sure y'all have friends, I have friends, like I've not had a kid yet. After 35, you can still have a really healthy pregnancy. Again, definitely optimizing other factors as well. But your ovarian reserve does start to decline a little bit. So it might take you longer to get pregnant. Your miscarriage rate also increases after 35. And so does the risk of having chromosomal issues like Down syndrome. Really, 40 is where the risks significantly increase and where that steep drop in ovarian reserve does happen. So I typically say over 35 should not be a reason not to try. You should, of course, try and everything, but maybe if you're over 35, think about what your timeline is. Maybe you want to speed it up a little bit if you can, right? It's not always possible. And if we're hitting 40, then we should really aggressively speed up our timeline.
How does family history, if at all, play into a woman's ability or a male's ability for fertility?
I think it affects males probably more because there are certain, like genetic disorders that can definitely affect sperm quality. But I actually usually say it's good to understand if you mom had a really hard time getting pregnant, you have a family history of things that we don't quite understand that are multifactorial, like endometriosis and things like that. But I actually say a good family history is not something you should take into consideration. So, my mom had 6 kids, no problem getting pregnant, I'm going to be fine. That doesn't necessarily mean that, right? Because as we know, things can develop like endometriosis, like other things that can impact fertility and difficulty getting pregnant. So I always say that shouldn't necessarily give you reassurance, if that makes sense.
It doesn't mean you will have problems, but it doesn't mean you won't.
You won't, exactly.
So I know there's a lot of family history screenings for cancer and things like that. Is there anything related to that you can do before you get pregnant?
Yes and no. So I would say if you want it, you're thinking about maybe I want to get pregnant in like a year. Like, what can I do now? Is that kind of to see if I'm fertile, right?
Yes.
Like, right, screening for fertility. Something I get asked a lot is like, which is the most important visit during pregnancy? And I always say, actually, your preconception consult before you get pregnant is the most important visit, because that's when we can optimize your health for pregnancy and screen for things that may be impacting fertility.
Okay.
So one of the ways that we can kind of screen for infertility, something you can do is something called an AMH test, which I do a lot for patients. It basically is a test. It's called anti-Mullerian hormone, and it helps us screen for your ovarian reserve. So it's looking at how many eggs you have available, not quality, but it's more of quantity. It was really developed in patients who had a history of infertility. So it's not the best screener for just normal healthy people, but if it's super low when it should be high, it indicates, okay, maybe we caught it and we can send you to like a fertility specialist to kind of work that up a little bit further, right? Typically, this is lower in patients with endometriosis, but it's one of the only things we can do to kind of screen for fertility. But other things you can do is if you have painful periods, talking to your OB-GYN about getting an ultrasound to look for, do you have fibroids? Is this something do you have any issues that we could screen for and address ahead of time instead of waiting for when you come in pregnant, right? So fibroids is one of them. You can also do genetic carrier screening testing, and that can screen for inherited diseases like cystic fibrosis and things like that to see if you are a carrier. And if you are, then, you test your partner to see if they're a carrier, to see if there's likelihood if you would have a baby affected. You can also screen for other things like prediabetes, thyroid disorders, again, optimizing your health prior to getting pregnant. So I think that's kind of one of the only things we have, like AMH tests, looking at your uterine structure, looking at the ultrasounds, doing giant carrier screening, and kind of going from there.
You mentioned this earlier in the episode about making sure you have regular periods. Why do irregular periods mean that our fertility may be off? Is it because we're not ovulating regularly, or what?
So if you're not getting regular periods and maybe you're going every 2-3 months without getting a period, typically that's a sign of anovulation. So it means that you're not ovulating properly, kind of like what you said. And it's not that it's just difficult getting pregnant, but it typically means that there's something going on with your hormones that is not normal, right? Some hormonal imbalance is causing you to not ovulate properly. And if you're not ovulating on a regular basis, it makes getting pregnant more difficult. It doesn't mean you can't. It just means that you might need a little bit of assistance.
For those of you who are longtime Health Her Way listeners, you understand that we love hormones and we hate hormones around here. And for those of you who are new, you will learn very quickly that our hormones are usually the center of all of our problems we're learning as women. So, tell us, when it comes to ovulation, that's when the egg is released every month, right? And that's how we have babies. How do we track our ovulation? Is it possible? And is it this misnomer of you only ovulate on this day, or is there a window, or how does that all work?
It's definitely a short window. Typically day 14 of your cycle, which means day 1 is the first day you start your period, and then 13 days after that first day would be day 14. And that's the most common day of ovulation. But as we all know, we're not all the same, right? All of our hormones are not the same. Everyone's different. So we don't always ovulate on day 14. And that's why tracking your ovulation is helpful to see, okay, what day am I actually ovulating? Because if you're not being sexually active on the day that you're actually ovulating or near it, it is more difficult to achieve pregnancy. So there are lots of ways of tracking. You can do ovulation strips. They have new kits out. Temperature tracking also helps with ovulation. I typically recommend patients don't just look at a calendar and look at 14 days later because, like I said, everyone is really different. So it is really helpful to actually use your temperature or doing LH strips at home.
One of the things that I heard a lot when I was trying to get pregnant was, it's okay because sperm lives in your body for 5 days. And so as long as you kind of have sex around the day you ovulate, and let me tell you, a year and a half later of trying to have a baby, I don't feel like that is a sound advice. So help me understand, is that true? Like, does it live there for 5 days? So as long as you kind of hit around the date, you're going to make it? Or is it like, no, you got to hit right on the day and time?
It doesn't need to be right on the day and time, but sperm can be affected by a lot of different aspects as well. So I'm definitely not an expert on sperm quality.
That's okay.
To be fair, that's definitely for urologists. But typically, sperm can be affected. So the length and lifespan of sperm can be different. It depends on right. Some sperm have better quality than others. Some live longer than others, right? It's so different. Some can live up to 5 days, but not all of them do, right? So I typically tell patients 2 days before you ovulate, start having sex every other day. Every other day can be better for sperm health. Some studies say that, some studies say every day, but just ideally around that time that you're ovulating, a little bit before, a little bit after.
So it's not technically true that you only have 24 hours a month.
No, definitely not. And if that was true, then natural family planning would be foolproof, right?
Yeah.
So, just not.
We already talked about cycle irregulations a little bit, but can you talk about how a long history of birth control can affect your ability to get pregnant, if it does?
So really, it doesn't, is what the data says. If someone's on the pill for a long time, it really shouldn't affect them getting pregnant in the future. My only misnomer with that is that sometimes being on the pill for a long time can cover up other problems that maybe you weren't aware of. So maybe you aren't ovulating regularly, right? And you're on the pill and you think it's not a problem. Or maybe you're on a certain pill that you don't get a period with, and then you don't get a period and you're missing other signs of potential issues. So in general, it doesn't affect fertility, which it doesn't. There's really no data saying that. I think it's a myth. I was on the pill forever. You're not going to be able to get pregnant. It's totally a myth. Just making sure that, you're still addressing other issues and everything like that.
We've kind of talked already about some preconception health and kind of optimizing that, but what other factors should people think about that maybe they don't when it comes to it? Is it you really need to drink a lot of water and stay away from alcohol? Is it way more rest? Should you start taking prenatal vitamins? We've kind of talked about some of the bigger things like diabetes and stuff like that, but how do those other little things that we do day to day, how can those factor?
Yeah, totally. So the first thing I'd say is your husband's or, your partner's health is something that no one thinks about, and it is so important. And I think now on social media, we're seeing a lot more people are talking about, your partner needs to do this and this. And I would say make sure that they are not smoking. That is a huge red flag for sperm motility. They're healthy. They're exercising, right? Exercising helps build natural testosterone, and that helps sperm production. So that's a big thing. Because you could be the healthiest person in the world, but if your husband is not, then you're gonna have a hard time getting pregnant, right? Mm-hmm. Other things to kind of optimize fertility ahead of time, I would say preconception. I always tell patients really technically 1 month is necessary for prenatals. I tell them 3 months. I think building up that really good folic acid in your body is so helpful, and 3 months ahead of time doesn't seem like a bad idea. I do tell patients also, before you're trying to, at that time when you're right about to start getting pregnant, decrease alcohol. Make sure you're not smoking. Like, live your healthiest self. And that's what I actually tell patients when you're pregnant too, is the time you should be your most healthy, right? Eating healthy foods. We know that there are endocrine disruptors, which are basically things that alter our hormones out there, whether that's looking at your cleaning supplies, overeating very processed, ultra-processed foods. These things do affect our hormones. And if our normal hormones are disrupted and we're not ovulating properly, it's going to be tough getting or staying pregnant. So all of these things in our lifestyle can also be very overwhelming, right? And I try not to tell patients to freak out. I kind of say, you can only do so much, right? But I do say kind of living your healthiest life, taking prenatals ahead of time, making sure your husband or partner's health is healthy. And I would say also getting up to date on your preventative screening, making sure, right, you're up to date on your pap smears, like you've had a breast exam, any other like preventative screening that you might be behind with, right? Like checking off all the boxes, making sure you're your healthiest self.
Perfect.
That kind of, you mentioned like the mental health side of it a little bit. So that kind of brings us to our next question. But how does stress and mental health impact fertility, and what emotional challenges do you see people face the most when they're trying to conceive?
So data's so wishy-washy on like whether being, it technically it says, right, stress does not affect ability to conceive. I think it's like back in the day, they used to tell people, you just need to relax. But I do feel like it takes a big toll on mental health. And I feel like women with underlying anxiety, which a lot of us and a lot of people do have, really it heightens when you're trying to get pregnant, especially, you probably remember that first 2 months when you're pregnant, you just don't feel anything. You don't know what's going on. And it could be very stressful and very overwhelming for patients. And, especially if you're trying and you're not seeing in that trying to conceive period and you're not seeing the positive pregnancy test, and it can be overwhelming. And I usually tell patients really try to stay off social media in those times, because I think that there's so much great stuff on social media, but it can also be so detrimental and negative on your mental health when you're just seeing all of these quick fixes to getting pregnant, and we drink this juice and do this cleanse and take this pill, and this made me pregnant after 1 month, and why isn't it working for me, right? And I'm very pro doing things like acupuncture and other natural remedies, but in general, I think it's hard. It's a hard period. It's a hard period, but I think taking care of your mental health is like the most important thing. And I think all the data that we've seen has really shown that mothers who have good mental state have better pregnancies. We know this. They have better pregnancy outcomes. It's a little like woo-woo, but I genuinely believe that like your baby can feel your mood and can feel can feel how, like, sense how you're feeling. And there are studies that women with anxiety and depression that's untreated have a higher risk of preterm birth, and they have higher risk of issues. So it is important to take care of your mental health, like primarily foremost.
I don't think that's woo-woo at all that you say that, because like after you have the baby, a lot of the times they tell you like, if you're getting frustrated because the baby's crying a lot, and like but if you're frustrated, baby's gonna be like, that's not a calming environment. And it's the same thing when the baby's in your literal body. No. So I will say for Covenant does have some pretty good mental health resources for women. And any woman who's been part of our OB-GYN clinics at all. And so I would say utilize them, because when we were trying to get pregnant, you get so excited those couple of days, like, when you get to test and find out, and that you're so hopeful. And then when you get like a negative, you're like, so it's just like so high and low, like constantly. And being on social media too, then you see like another friend, and it's not that you're unhappy for somebody who's having success, but it also is like, gosh dang it, like, why not me again? And so I think everything you just said, as someone who personally struggled with it, was spot on. And I would encourage women, if you're part of our program, to find somebody to talk to, because it can be a little frustrating and stressful sometimes too. So, but thank you for all those good tips.
Yeah, totally.
What other common health conditions can impact fertility? We're hearing a lot more these days about PCOS, endometriosis, thyroid disorders. And so that's definitely not something that's going to be typical of every patient you see, but obviously some people will have those issues.
Yeah. So PCOS definitely is becoming more common. And I think that's honestly really because of like what's our environment, what's in our food, right? All these endocrine disruptors, like I said, ultra processed foods, obesity, childhood diabetes, all of these things really impact like increased risk of you having PCOS. Family history also, diabetes can do that too. But I think PCOS plays a big part of the ovulate normally, but I think kind of something that all women should kind of be on the lookout for, because you might be getting, regular periods, but if your periods are very painful, you should like overly painful, right? Not just I have a cramp and I take some Advil and it goes away, but if you're taking medication and it's not getting better, that's one of the easiest signs, or one of the first signs of endometriosis, right? Extremely painful periods. And I don't know if it's just selection bias, but I have seen so many young girls with endometriosis that I am almost surprised, right? I think it's a lot of environmental influencers, like I mentioned, but endometriosis is something that can significantly impact your fertility. And it's, like I said, screening with an AMH level is a great idea for those patients who are like, listen, I've had terrible periods. I don't know if I have endometriosis or not, but I'm worried about getting pregnant in the future. Like, that's a great screening tool. If that's low, you can get into the fertility specialist ASAP and kind of get that addressed early on, because not everyone's ready to have a kid when they're 20s, right? So that kind of takes care of that. But also, there are treatments for endometriosis, there are medications, there are surgical interventions. So kind of not ever ignoring those warning signs, I think is really important. And of course, there are other conditions too that can impact fertility. Certain clotting disorders can, as well as thyroid disorders as well. But, the best way at kind of managing that is really just keeping them well controlled and falling with someone, right? The first time you see a doctor should not be the time you get pregnant.
Okay. I feel like this usually comes from a place of great intention and poor execution, but moms, aunts, grandparents, they'll share all these kind of random things that they honestly Bible think is truth and it's not, or whatever. So we hear a lot about them. Some of them were like, okay, don't go in a hot tub or whatever, or don't put a laptop on your lap or whatever, for my husband specifically, because sperm don't like hot environments. I'm like, that's interesting. Another one was like, make sure after you have sex to keep your legs up in the air for 20 minutes afterwards. I'm like, that's great. Now I just have a headache. So I think you hear all these most random, and I'm sure you probably hear even more than I do. Like, so what do we kind of do? Is that one of those things that in these preconception appointments and things, we come to you and we go, let me be honest and let me ask the questions that may seem silly.
100%. So I always tell patients at the preconception consult, we're doing a couple things. We're going through the medications to like make sure that we're on safe medications getting pregnant. We're going through like, again, optimizing health, like medical conditions, weight. Do we need to like lose some weight? Do we need to start exercising? Well, exercise is good and healthy for pregnancy. Like, so we're trying to optimize our health also. Like I briefly mentioned, I try to encourage them to have a decent insurance, because I don't want anyone getting a massive bill when they get pregnant, because that, children are expensive enough. So there's something. And again, optimizing like husband's health, right? But it is a good time to ask questions, because a lot of people don't know, especially if you haven't started before trying to get pregnant, or maybe you just got pregnant really easily and this one's taking a lot of time. Try to plan out a little bit and like go through things. So I always tell patients, okay, preconception consult, we go through all those things, and then just try on your own for a couple months and just don't stress about it. Try to have fun. Try ideally to have sex like about 2 weeks-ish after your period starts, but just enjoy it, right? And then if we're not pregnant in maybe like 4 to 6 months, you come back and see me and we'll go through in detail how to get pregnant and like what we need to actually be doing. And part of that is kind of what we mentioned before, like helping your mental health a little bit, so you don't need to be stressed out for no reason. But yes, asking all the little questions, like there is some data actually that saunas, repeated saunas, are actually very bad for sperm health. So listen, I tell my fiance all the time, I'm like, you enjoy your sauna, but you are not allowed to go in the sauna every single day of the week. I'm sorry. You can go like once a week and that's it, because it can be bad for sperm health. So that there is definitely some data behind that for sure.
Okay.
Is a laptop on your pelvis like the best thing to have like 24/7? Probably not. But like here and there, is it going to do anything? No. Right? I mean, our bodies are resilient to a certain point, regardless of all the environmental exposures that we have to all this bad stuff. Our bodies are resilient, right? Especially women. Mm-hmm. So, yes, I do hear a lot of crazy stuff. I think the legs in the air is not a real thing. But
Good to know I spent a lot of my time in that position for absolutely no reason.
Yeah.
But I have a 3-year-old, almost 4-year-old, so I guess it worked. But anyways, that's funny though.
Yeah.
You mentioned something in that conversation though about secondary infertility and just how some people who maybe didn't have any issues the first time are now experiencing those things. Is that what is secondary infertility?
so mostly it's because you were younger when you had your first baby, right? And that's typically the most common reason. But also there are other things that happen during our lifetime as we get older, in our late 30s, things like uterine polyps that can develop, right? Uterine fibroids, like these are very common things that happen that maybe were not there before. Rarely you can have like more rare situations. You can have scarring, or you can develop a clotting disorder. That can happen. I've had patients who have absolutely no problem getting pregnant the first time, and it took years the second time to get pregnant. Sperm quality can change. So there's a lot of things that can change in your body. You can gain weight. I mean, as we all know, we know after a baby, it's harder to lose the baby weight. It is. So a lot of things can influence our hormones, our uterine cavity, structural things, hormonal influences, sperm influences. So there's a lot of things that can change in those years. And it's hard because if you didn't have trouble getting pregnant the first time and you do the second time, it's really stressful and it can be very taxing, especially when you're trying to build your family.
Great place for us to kind of stop this part of the conversation, but we are enjoying having Dr. Mowzoon on here answering all of our questions. And so stick with us. This one's going to be a 2-parter. Come back and we're going to talk about pregnancy and postpartum. We'll see you soon.
Thank you.
Thank you all for listening to this episode of Health Her Way. If you enjoyed the conversation, be sure to follow the podcast wherever you listen and share it with a friend.
If you have questions or topics you'd like us to cover, connect with us on Instagram or Facebook at Covenant Health, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.